Okay. This is Shelly Hewitt. She is a teammate of mine, and she was diagnosed with Guillain-Barré when she was young. All right. So, at what age? Well, first of all, how old are you?
I'm 43.
All right. At what age were you diagnosed with Guillain-Barré?
15 years old.
Okay. What were your presenting symptoms? Like, how did you, when you first started feeling funny, what were those symptoms?
That I was really tired and weak.
Okay.
Just weak. I normally would draw. I could draw, and I was active. I was an athlete, and I was really tired. I actually fell asleep in a class and got in trouble for it.
Okay.
Which, I mean, it was certainly out of character.
Yeah.
But that was probably the very first initial symptom was just weakness, tired weakness.
Okay. That didn't you say like it happened? That happened like one day, and then you went to sleep that night and fell when you got up there or something?
Yeah, it started out in class. I fell asleep. And then that afternoon, it progressed. I got more tired. I was sitting on the couch. I got up to answer the phone and fell. Been known to be clumsy sometimes, but it was a lot of tripping and just feeling really tired. I took a nap that afternoon, not something I've ever done. And woke up the next morning, and my legs felt so heavy. I felt like I'd been at the gym and, just really tired. So I kind of slung my legs over the bed and went to stand up and fell on my face.
Okay. So that was basically the most, I guess, thing that you remember the most is that just weakness everywhere. It wasn't like pain or
No,
anything
that
else
came
that you
later.
noticed?
Yeah.
So were you able to walk at all, or?
No, I couldn't get up.
Okay.
I couldn't get up at all. I could push myself up, but my legs, I had no strength.
Okay.
My grandparents picked me up
Okay.
and had to put me on the bed, and basically I couldn't move or do anything, so I had to wait for them to put me in the car and then take me to the emergency room.
Okay. So from that point, they just took you straight to the hospital?
Well, we first went to the pediatrician, and the pediatrician kind of had an idea. Actually, he mentioned something about it, but he wasn't really sure, and immediately sent me to the neurologist. The neurologist, I guess kind of a high-level diagnosis. I had thought Guillain-Barré, and then he immediately said, get to the hospital. So they took me to the hospital, and they admitted me right away.
Do you remember how they diagnosed you, even in the hospital? Like what they did? Did they do blood work, or?
There was some blood work. There was a lot of reflex testing, and I didn't have much reflex, or if any. I was very, very limited. Strength, they did strength tests and checked my breathing and a few other things. Just kind of head to toe, a little bit of everything. And then when they pretty much diagnosed it, I guess at that point, and waited for progression to see if it was really going to follow through with what they knew Guillain-Barré to be.
Okay. Did we kind of learned that like the symptoms started distally, like at the feet or the hands, and then kind of moved up more proximally? Did that happen too?
Yes, my feet. It was
right away. Like when you fell, did you notice that, or like over time?
I felt some tingling in my toes, and like just utter weakness in my legs, and then tingling, and then over the course of time, it went distal to proximal. Everything just kept climbing, and my hands started to get weak, and I got tired. And
like over time, do you mean like a long period of time, or like within that day you felt that?
Over a long period of time. It was progressive. So there, I was in the hospital. I don't even know how long it was. I got to remember way back, but it was in the hospital every day. It was weaker, and then things started to get, it just got to the point where I couldn't get up, so I couldn't walk, and then sensitivity increased like tenfold. It was probably one of the most aggravating things, most painful things I think overall that I had to deal with.
That's right. I remember you saying that everything was like super sensitive to the touch.
Yeah, real hypersensitivity and sheets. I mean, to cover me was awful, and that was probably one of the most painful parts of it, was dealing with that. I mean, laying in the bed was aches and pains of just not being able to move, but that was really the most excruciating part. And then eventually circulation, my veins would roll. They'd have to come and pull IVs and
So did you ever have an issue with actually like breathing difficulties?
Yes.
Affecting breathing?
I did.
How long did it take for
started
that
breathing tests immediately.
Okay.
They came and brought a little breathing.
As soon as they diagnosed you?
Yeah. So they started measuring my breathing right away. And twice a day, they were testing me in the morning and then at night. And over time, of course, the breathing got more and more labored. And then eventually, I was having a lot of difficulty. It was really, really hard to breathe. And they were I think they were bringing the breathing test in probably 3 or 4 times a day. And I never was on a respirator, but I was probably about 24 to 48 hours from getting on one.
Oh, wow.
Yeah, they were really close. They monitored me, 24/7. So
How long did it take before, like, you would say, like, the peak of your symptoms to come on? Like, how many, I don't know if it was days or weeks or
I think it was
months
probably, if I remember correctly, it was probably weeks. I was just, like over time, just every day I'd wake up and it would be harder and harder for everything. And then eventually, I want to say it was probably 3 or 4 weeks before it really got difficult.
Okay.
Yeah.
I don't remember if I asked you, but what age were you when you were diagnosed?
15.
15. Okay. All right, so what would you say would be, which activity would kind of be the most difficult for you when you were diagnosed? Either, right when you were at home or even in the hospital. Like, what was the most difficult for you?
It was impossible to walk. I mean, I certainly couldn't do that.
Even with an assisted device?
Even with an assisted device.
Okay.
Early on, I could,
Mm-hmm.
but they would get me up and try to get me moving and try to keep circulation and keep me mobile. And eventually, my arms were weak, so I couldn't get up with a walker or do anything like that. And then it got to the point where I had to sleep with high tops on. Back when high tops were up to your, your calf.
Yeah.
I'd slept with high tops to prevent drop foot.
Okay.
And that was very common.
Yeah.
I mean, that was the first thing they said is if you're gonna lay on your back all this time, we've got to keep it from falling.
That's interesting.
Yeah.
I
think now there's probably other devices.
Yeah, I'm sure, but
yeah.
I've never. I mean, that's kind of ingenious that they thought about that then,
Yeah.
way back then.
Right.
Okay, so how long, like a period of time, did those symptoms last before you started to notice a difference towards you recovering?
I want to say it was probably 12 weeks, 10 to 12 weeks, I think.
And you were in the hospital the whole time?
Yeah, I was in the hospital the whole time.
How long were you in the hospital?
I was in the hospital for, I think, 18 weeks.
Oh, crap.
Yeah, it was a long time.
And even when you left the hospital, were you 100% clear? I mean, or did it take even longer to relieve all the symptoms?
I went through a lot of, actually while I was in the hospital, I went through a lot of whirlpool therapies. Okay. I did a lot of stuff in PT that, I'd go up and walk on a bar, I don't know what it was, but.
Parallel bars?
Yeah, parallel bars, yeah. They go through that with assistance. We first started up just trying to get me to stand, and then eventually working through the parallel bars. And then I went to a walker, and they kept me in the hospital, and then I would go through, and they'd come in and get me up and keep me up, and then they eventually had me sit up so many hours a day, and eventually just try to sit up in a chair and not in the bed, and only go to bed when it was time. And of course, that's back when you stayed in the hospital forever.
Yeah, that's true.
But
okay. All right, so let's see. You don't have any further problems now or issues with that, right? Do you notice any
I don't
changes?
think so. I did think for a while I've had ACL injuries, and I had one 2 years after I had, and then another ACL year after that. And I wanted to contribute, just kind of assume that maybe that might have contributed to the injuries, but I don't really know for sure. I did have a bout approximately a year later, a flare up, and I can't even remember the acronym, but it was like
CIPD.
That's it, something like that.
Yeah.
And I was out of school for probably 6 weeks, but home. I was homebound. Took the hospital. They said, well, let's keep an eye on her. And at that point, it was just all, they'd have someone come and visit and do testing and things like that.
And it just cleared up on its own?
Yeah, it just kind of, it's like the peak. It just starts and it gets bad and then it gets better.
Okay.
Yeah.
And nothing since then?
Nothing.
Well, that's good.
Yeah.
That's good. I forgot to ask this, but typically Guillain-Barré starts from a previous infection or being sick. Did you have that?
I had a virus probably earlier in the week, or maybe
just a cold,
4 or 5 days before. I think so.
Okay.
I think it was like a cold, and then of course I've learned that over the years that it typically follows something like that, some type of virus or illness. And we targeted. That was funny because the doctor asked that question. He said, "Has she had a cold or been sick or anything like that?" And I had just finished antibiotics.
Should have kept going on those antibiotics.
Yeah, right?
Who knows? Well, that's interesting. But you have no family history of anything that would pertain to you having Guillain-Barré?
Nothing neurological that I'm aware of. No.
Okay. And besides having Guillain-Barré, do you have any other additional like diagnosis besides having ACL, orthopedic injuries? Any other issues
No.
medically?
Mm-mm. Nope.
Healthy as a horse?
It's as healthy as I can be.
All right. Do you remember any of the medications that you took?
I was on heparin for, I guess, as long as I was in the hospital.
Okay.
Prednisone,
Mm-hmm.
tons of that, and of course the side effects from that. I'm sure there were some others. They went through some pain medications for pain.
You know,
and
prednisone is a steroid that weakens ligaments over time as well, right?
No, really?
Yeah.
I never really realized that, which makes perfect sense.
I'm going to edit that part of the video,
Okay.
but that's the reason why I also tore my ACL too. But,
No kidding.
yeah, but that I had just finished mine, like, I don't even know. It was like, well, I guess it was a couple months.
Mm-hmm.
The last time I tore my ACL playing football.
Mm-hmm.
But I was training for that figure competition. I didn't realize I was taking steroids. And I
That's
knew it lacks ligaments, but I was like, it surely won't happen to me.
Right.
Fair
I
enough.
don't even know. That's crazy.
Yeah.
I don't even know.
There's lots of bad. So that's why I always say don't take antibiotics unless you absolutely have to, because it has so many side effects besides simple stuff like gaining weight, and
Mm-hmm.
I mean, it obviously decreases bone density over time, and
Right. Right.
God, there's so much.
I was on it for
stuff.
months. I mean, I was on prednisone in the hospital. I was also on it out orally. I had it afterwards. So
Wow.
I was home taking pills and.
Yeah. Well, I mean, it's better to deal with the side effects than deal with actual Guillain-Barré.
Yeah.
So.
Yeah. It's pretty. Yeah. Excruciating.
Okay.
I learned to write again and walk again. And
Oh wow.
it's kind of one of the craziest. Yeah. I couldn't pick up a pen. I couldn't feed myself and. Yeah,
Was that?
a lot of
I
stuff.
guess it was a combination through OT and PT then that kind of helped you out.
Oh yeah.
Do you remember?
Oh yeah.
Okay.
Oh yeah. It was a lot. I did. I went through a lot of right off the bat, a lot of OT. It was just constant, just very simple things. Placing, it was the typical stuff of placing the square peg in a round hole and that kind of stuff.
That doesn't fit.
That's why I didn't graduate from PT. That's why.
That's funny. So what would you say would be kind of like, I guess, the key thing that helped you the most with your condition?
Honestly, it's hard to say. Whirlpools were great, but that was once I could finally stand the water on my skin because everything hurt. I don't know, just physical therapy was great, and I'm an athlete, so it certainly was something I look forward to. And I can tell you right now that I know for a fact when the doctor told me that I was going to have, probably had difficulty walking for the rest of my life, I refused to even believe that.
Mm-hmm. That's
and
good.
Maybe that could possibly be the only thing that got me through it, but
Yeah.
I know a lot of PT that certainly worked through quite a bit of my weaknesses and things that I had to learn all over again. And
do you remember anything that didn't work? Do you remember like trying something and not seeing any progression or?
not that I could think of, because I think everything at the time, I know what I've learned of it now is everything at the time was probably pretty elementary.
Mm-hmm.
It's progressed a lot now,
Mhm.
so I don't know that I've ever really done a whole lot. At first I thought the breathing treatments or the breathing measurements or whatever it was kind of hokey, because I was just blowing this ball up and down this tube and I didn't know what it was for.
Yeah.
And then when I started to have the difficulty breathing, I understood it. I mean, I knew what that was for, but I never really, I would assume the prednisone probably assisted. I know heparin worked great.
Mm-hmm.
I mean, I know it was, when they would try to take me off of it and not have it anymore, I'd start having problems again, and we have to get working on circulation and injections and
Crazy. That was crazy.
Mm-hmm.
Well, how long did it take for your symptoms to disappear completely, besides the relapse?
I would say the full year.
Okay.
I mean, almost. I couldn't participate in anything active, like sports. Obviously, I mean, I walked and I did constantly, walk a couple miles a day and as often as I possibly could. But I would say probably I felt like I got my strength completely back in roughly a year.
Okay.
Yeah.
Okay. Now, as far as like strict intervention, do you remember anything as far as like any NeuroRead eStim that they used?
I believe they did use some stem. And it was later on again when I could stand to be touched.
Okay.
It didn't hurt. I did certainly in PT. I know we worked through quite a bit of that.
Okay.
Doing a lot of work.
How about did they try to use any splinting for range of motion? I know you said the high tops, but
Yeah, high tops. I didn't use really anything else.